Hello and welcome to this very special episode of the Neuroaid podcast, where we bring together expert insights into child development and rehabilitation in Down syndrome, with all its challenges and a special emphasis on the multidisciplinary team approach for improved outcomes. To shed more light on this topic, we have come together as a team of professionals from the Neuroaid and Research Foundation to explore medical, therapeutic, and educational interventions to not only enable and empower persons with Down syndrome but also their families. I'm Dr. Monika, occupational therapist, and with me today is Rajni Nagar, our senior consultant special educator, Dr. Stuti Sharma, senior speech and language pathologist, and Dr. Priya Jain, senior consultant neurodevelopmental pediatrician. So let's start. So Dr. Priya, can you tell us what exactly is Down syndrome and shed a little more light on the condition? And is there any way can we detect the condition at the time of pregnancy?
Yeah. So Down syndrome is the name which is given to a genetic condition in which the individual has an extra copy of the chromosome 21. Now, all of us have 23 pairs of chromosomes. One set comes from the father and one comes from the mother, and that's how a pair is made. Now, in Down syndrome, two come from one parent and one comes from the other, which means that we have 3 of chromosome 21, which is why it is also called trisomy 21. Now, this extra genetic material is the one which causes all the physical, cognitive, developmental delays in children with Down syndrome. It also causes certain medical conditions. And mostly Down syndrome, because it has characteristic facial features, it is very obvious at birth. But we still go for a confirmatory test, which is karyotyping, to confirm the diagnosis of Down syndrome. As far as antenatal diagnosis is concerned, the recommendation is that all mothers or pregnant women who are of any age, so it is irrespective of the age. Initially, the criteria was that because it is related to advanced maternal age, then initially the criteria was that all women above the age of 30 or 35 should be going for the antenatal diagnosis. But now it is recommended that all women have to go for antenatal testing or should go for antenatal testing, preferably in the first trimester. And with the the array of tests which we have to detect Down syndrome and other chromosomal anomalies in fetuses, we are able to detect to a accuracy of 95% in the first trimester itself. And therefore, the option of whether you want to continue with the pregnancy or whether you want to go for an abortion, because before 20 weeks, the abortion is allowed easily by the MTP Act. So that, you have that gap or that safe period in which you can decide, think, and plan accordingly whether you want to go ahead or you don't.
You did mention that there were certain medical conditions associated with Down syndrome.
Yeah.
Can you elaborate a little more on that?
Right. So the most common would be a congenital heart defect. So almost 40 to 60% of children with Downs tend to have congenital heart defects. The others are vision impairments. They are mostly refractive errors. Then we also have hearing impairment. These children are more prone to recurrent chest infections or ear infections even. There are also a lot of thyroid issues, mostly hypothyroidism, but they can also have hypothyroidism later on in life. So a thyroid testing not only at birth, which is done for all newborns, but with children with Down syndrome, we need to regularly do thyroid testing for these children. Yeah.
So how frequently are follow-ups recommended? You just mentioned that thyroid needs to be done frequently.
Yes.
So the cardiac conditions.
Yes. So the cardiac condition is mostly diagnosed at birth itself. An echocardiography is recommended for all children with Down syndrome at birth, and then a follow-up at 6 weeks. If that is clear, then we don't do a cardiac follow-up anymore. But there are the other follow-ups have to be done very regularly, whether it is investigations, whether it is vision testing, whether it is hearing testing, they have to be done periodically. So there's a very good consensus guidelines for children with Down syndrome, which is being taken out by the Indian Academy of Pediatricians, and it is available freely. So you can just go to the web and put in consensus guidelines for Down syndrome. Now that has a very beautiful detailed chart in that, in which it is at birth what are you supposed to do, then at these many weeks, then at 2 years, 4 years, 6 years. And if you just have that chart, then the parents becomes very easy for the parents to just, have their timeline in their mind that, okay, these things are to be done and at this time. So it becomes very easy.
Like the vaccination card that
absolutely, absolutely. Yes.
At this age, this steps has been done, this age, this steps.
Exactly.
Like a check off this.
Exactly.
That's really, I didn't know about this.
Yeah.
That's really
there also is a very, in that itself, in the same guidelines, there is something called DS specific growth charts. So children with DS or Down syndrome will not grow according to the general population. So they have to be followed on their specific growth charts. So the height and weight of children with development or Down syndrome have to be or should be measured on these specific growth charts. Otherwise, they will always fall below the other kids in their centiles, and you will always feel that they are, lagging behind. Yeah.
So that is in fact insightful knowledge. So coming to Dr. Stuti, speech and communication are usually associated with appropriate social interaction. We've seen that a whole lot of our Down's children or adults, they're otherwise very friendly. So where does speech come into the whole picture? Because they are friendly, they do communicate, they are very social. So where does speech really fit into the whole thing?
Yes. So speech and language is most often delayed in children with Down syndrome. Early intervention is the key to maximizing benefits of speech therapy. Speech therapy significantly focuses on enhancing language comprehension, overall sound production, and of course focusing on their needs and emotions. While we help them understand better how to communicate using different verbal and non-verbal methods like sign language and visual aids. These really help children with Down syndrome to communicate better. Communication begins at home. So generally they have a low motivation to speak up since the drooling is also affecting their confidence at some point. Swallowing support is another thing that we provide in speech therapy, which helps them process their food better and also helps them process their speech better. So overall, there's a very comprehensive environment that provides, an individual with Down syndrome to communicate in many different ways, verbal or non-verbal, and make them super independent in terms of communication.
So what I'm hearing is that you're saying that a whole lot of this intervention, of course, will take place at the therapy center. But is there anything that the parent can do at home? Because exercises, when exercises comes to the mind, it's something that you say that unless done regularly.
Certainly, certainly. So a child spends maximum amount of time at home. Therapy sessions are majorly thrice a week or twice a week. And I believe that communication begins at home. So parents can provide crucial support in communication. Simple exercises like reading to the child, singing interactive songs, and encouraging them to have emotions presented through their facial gestures. And any kind of communication support that can be provided at home will go a long way in showing progress in the child's communication.
So coming to the educational issues, Rajni, a lot of our Down's children and adults are faced with cognitive delays. So intellectually, how would you as a special educator kind of say that, okay, this child needs to go to a mainstream school or this child needs to go to a special school? How does the education support system currently, which emphasizes so much on mainstreaming, where does that come in, and what are the strategies that an educationist will typically employ in a mainstream school setup? Special school definitely is a structured environment, but in a mainstream school setup, to make the child more comfortable and make more effective the learning opportunities.
So, Monika, another question is when the child is the age of the child. Whether the child is coming for the pre-primary school or the child is ready for primary education. So we have, and we assume that before he starts schooling, he's already been to the therapist, and the child is, say, fairly settled to be, involved in, to be, included in the mainstream education. And a lot of our schools have inclusive, they follow inclusive education now, so they are inclusive schools, and teachers are kind of given training from time to time so that they are aware about all kinds of disabilities. So assuming that everyone is ready and the child is here to be included in the mainstream education, So we have to see what is the level of the disability, the intellectual disability. Because it could be mild, it could be borderline, it could be moderate. So depending on this level, we need to make a plan. So it's something called IEP, where we make a plan, we set goals, academic goals for the child so that the child comes up to a certain level of learning, something called MLL, minimum learning level. So now these goals, these academic goals are set according to the assessment which is done by the special educator. So, and in collaboration with parents, other therapists, and special educator and the teacher, all these goals are set in the document. Something called IEP is prepared.
What exactly does IEP stand for, and how does it really benefit the child with Down syndrome?
Okay, now when the child comes to school, we need to have clear understanding of what are the limitations of the child. So for that, the teacher has to understand how to deal with the child in the classroom, because the teacher has 35-40 children in the class, and the biggest challenge for them and the biggest apprehension is, how am I going to manage this child? I don't even understand what is the level. So here the special educator comes into the picture. The special educator makes the teacher aware of the level of the child, and then with the help of the parents and the school counselor, say multidisciplinary team, the certain academic goals are set. So the goals could be, depending on the disability level, the goals could be that the child is made to learn, suppose it's moderate or a little higher. Then the functional training can be, functional academics can be taught to the child. If the child is say mild, certain basic skills can be planned for the child to be learned, like basic numeracy and literacy skills can be planned. So all these goals are defined in the IEP, which is individualized education plans. So with this IEP has short-term and long-term goals. So if the child has to be taught, let's say, counting, so what is the short-term goal? Like say within a month, the child has to learn, say, counting from 1 to 10. This counting could be in rote counting, and then it could be like random dodging kind of counting. So like this, at different levels of goals are set. And then parents and teachers and of course the special educator, they all work towards achieving these goals. So that is the purpose of that.
Okay. So where does NIOS fall into this, the National Institute of Open Schooling? Is that does it have a significance as far as our Down syndrome children also are concerned, if they're not being able to cope with the mainstream education?
Yeah, NIOS is of great help, because see, initially the schooling, mainstream schooling is important because socio-emotional development and communication and other things. But at academics level, functional training and all is fine, because the child has to learn the basic day-to-day life skills. The child has to learn. But for having some kind of a future and some to follow up the vocational,
even college education for that
college
matter.
education, before that the school education, the child needs to have, because see, as we all know, Down syndrome children have certain issues, like they have memory is not so great.
Yes.
So they need to be given repetitive instructions are to be given.
Correct.
Repetition has to be made. Then they have certain kind of they need breaks, which cannot be managed at a middle school or secondary level. So the NIOS becomes the best option for them, so that they can choose the subject as per their strengths. See, for that parents come into the picture, because they have to identify the strengths of the child, interest areas.
Yes.
So once that is clear to them, then the child can be, the subjects can be opted according to the interest, and the child can pursue and the education according to the interest.
Fantastic. I think that was wonderful. So, Dr. Priya, we've been talking about multidisciplinary team approach. In your experience, have you ever had a chance to kind of compare a Down syndrome child going up to the old age, where he has received or she has received intervention only from a certain profession and not received intervention from maybe an occupational therapist or a speech therapist or a physiotherapist. And have you seen any differences? Do you recommend a multidisciplinary team approach? Because sometimes what happens is that parents, they get so confused going from one profession to the other. A lot of time things are repeated. A lot of times parents can't pay for the therapy sessions, so they all, they say, "Ki, acha, okay, I'll just do this and nothing more." So, do you feel that approach, that targeted approach कि एक ही therapy करेंगे और बाकी चीज नहीं करेंगे, वो कहीं ना कहीं बच्चे के progress को hinder करता है?
100%. See, Monika, when we talk about Down syndrome, the first thing which comes to the parent's mind is the medical management, the immediate medical management, the feeding difficulties, the cardiac defect, the hearing assessment. So all this is going on in the initial infancy period, and it really just drains them out. Then when you tell them that, okay, the child needs also physical rehab, communication rehab, then later on cognitive rehab. So the parents are sort of, at a very low point at that point of time. But the mainstay of having a child who is developing holistically, who can actually go to their full potential, and children with Down syndrome have a lot of potential. They can lead absolutely independent and fulfilling lives. There is absolutely no reason for them to be restricted. So when we talk of that, we definitely need to work on not only physiotherapy, because that is supposed to be, in everybody's mind, that is their mainstay. But if you add communication and speech therapy, if you add special education, if you add behavioral therapy when they have emotional problems, then all these tend to really help the child, develop and grow into a fully participative member of the society. We talk about all the interventions which are required for a child with Down syndrome, or even for an adolescent or young adult. There is one therapy or one intervention which is not that prominently spoken about, but which has immense benefits, and that is occupational therapy. Now, when we tell the parents that the child requires occupational therapy, the first sort of idea in their mind is that, our child is so small, so why right now are we talking about something like a job or, occupation? So can you just clarify, Dr. Monika, what occupational therapy actually entails?
Yeah, so I'm glad you brought it up, because the first thing that comes to everybody's mind, as you said, is an occupation. So a lot of people come up to me and say, "Oh, you're an occupational therapist. So please tell us, we want to change our job." Yeah. So I think this is a great platform to also communicate that occupational therapy improves the efficiency of an individual in their functional independence 24/7. So besides the obvious, the physical aspect that we take care of, including gross motor and fine motor skills, where we need to put up a basic program for an individual with Down syndrome, because they have low tone, they have a lot of muscle weakness. So just to be able to function at an optimum level, so that physical exercise is extremely important, not only for a child with Down syndrome, but as they continue with their lifespans. Because low tone is something that doesn't go overnight. It requires a constant, practice, a constant regime. It's like, if you don't exercise, then suddenly you will realize that you've got flabby muscles and all that. So you just have to keep working on it. So there is no beginning, or there is a beginning, but there is no end time to that. So OTs work on the motor aspects, gross and fine motor. We also take care of a lot of posture, coordination and balance issues, because other than having the obvious therapeutic benefits for a person with Down syndrome, if you sit up straight, if you conduct yourself, if you carry yourself with confidence, then those also go a long way in improving the confidence and the self-esteem of a person with Down syndrome. So besides these motor aspects that we're talking about, an occupational therapist also deals with cognitive delays. You will also look after a whole lot of sensory processing deficits that a person with Down syndrome might have. Now, all these put together will enable an individual function in his daily activities, right from the time he gets up. And that means occupation, yes. So, so that is the misnomer. So occupation is when you're doing your activities, when you're doing your self-work, functional, correct. So when all these come together, you have a basic efficiently, you can you eat your food properly, you can write properly, you can button up your own clothes, you can brush your own teeth. But it's not only restricted to self-care activities. There is also something known as instrumental activities of daily living, where it is a whole lot of community involvement which happens. So, initially we only focus on the therapeutic interventions in a structured environment. So we're dealing with motor skills, we're dealing with sensory issues, etc. But the child ultimately has to go into the world. And that's the time when the school play setups, workplace setups, those are the times when you have to keep reviewing them. So as we said, therapy doesn't just stop with the department. It has to go beyond. So an occupational therapist will also give a lot of suggestions as far as the school environment, the workplace environment, play setups for a person with Down syndrome. Besides that, we also do a lot of environmental adaptations. So the whole idea is to make the person with Down syndrome feel comfortable, fit in with, it's like, that puzzle which has one piece. So that Down syndrome person is trying to fit in, and with all these interventions, he's kind of chiseled finely, and it just fits perfectly. Yeah, so that's what we do in a.
So here I have a question for you, Monika. See, lots of time we've seen when the child starts schooling, the parents tend to give up. In the sense they say, बहुत therapy करा लिया मैम, अब थक गए, कब तक कराना पड़ेगा ये therapy? And then we have to keep counseling that this will help the child in writing, this will help the child in settling down in school. But then they tend to कि अब इससे क्या हो गया, बहुत कर ली therapy. So how do we
Yeah. So when something like this happens, usually, as we said, any intervention for any condition is a lifespan approach. So at a certain point, when when the Down syndrome child comes to you and the parents come along with it, you do active interventions and you bring the level of the child up. You bring the child up to a certain level, beyond which as a professional that this is it. You can maintain it. So that maintenance is something that has to be counseled. The parents have to be counseled on the fact that after a certain level, there may not be very significant changes, but whatever changes have already been achieved, those changes have to be maintained over a period of time. So that requires a different set of counseling and a different role altogether. And that is really what we have to tell the parents कि आप ये सब चीजें जो है बहुत common है. आप exercises अगर आप therapy center में आप कोई equipment से कर रहे हो, जैसे if you're using the medicinal ball for foot exercises, or we're using the ankle rotator for ankle movements, or we're using a ball for throwing with resistance, all these activities after a certain stage we tell the parents कि आप उनको भेजो classes में. You go for enroll the child in a football class, or enroll the child in a skating class, teach them swimming. So those are also skill activities. They're also giving them opportunities to interact with others, and it is also taking the load of the parent, because you can't keep going to therapy all your life. So there has to be a cutoff point where you go for active intervention, and after that you follow up regularly, as we do in medical management. You follow up regularly. Similarly, once in 6 months or once a year, depending on what the situation is, or if there's a specific concern कि school से ये problem आया है कि the child is having this particular issue, so then you come back to your therapist, you come back to your professional and ask them, these are the issues, can you help me with that? So that's how we usually deal with something which is a lifelong condition.
A lot of parents tend to come and say that therapy kitni chalegi, and there are certain unrealistic expectations that the parents have. A lot of them also happen to be in denial regarding the communication of the child. So it's very important for us as therapists to counsel the parents actively and very strongly that regarding the condition of the child. Also the fact that each child is different and everybody's progress rate is completely different from the other. Another point that all of us do focus on is home training. Like I said, parent support is crucial in communication, and also I'm sure with regards to occupational therapy and special education as well, the more the parents work with the child at home, the faster the progress, and it helps the therapist take up different goals in each session. Otherwise, if there is no practice happening at home, we keep doing the same thing over and over till the child grasps it. So having certain realistic expectations from the therapy is also important from a parent's point of view, and it is on us to actually provide them the sort of support emotionally and via counseling that this might be the progress rate of the child and what to expect.
And of course, this is a very crucial area, and we are going to be doing a day 2, especially addressing counseling issues. And so this is something that we have really found, that if the parent is not on the same page as the therapist, or on the school, or the teachers are not on the same page as the parent and the therapist, then the child suffers.
For all lifelong conditions, it is essential and crucial for the parents to be supported, and for us to work together, the parents and all of us to work together with the child.
So, well, we've discussed on a whole lot of aspects, and before we wrap up with day 1, one key takeaway to all our parents and caretakers from each one of you. Dr. Priya?
The parents receive the diagnosis of Down syndrome, it becomes very overwhelming for them. The medical management, immediate medical management, this has to be done, this has to be done, this has to be done. Then followed by, when you discharge the baby, then you have this whole lot of feeding problems which keep happening. Then you tell them that, okay, the child needs to have physical therapies and all the interventions which we've discussed, and they are going to be lifelong. So the parents, it becomes very, they start feeling the burden of all this. So my message to the parents would be, see, there's this very famous line which says that it takes a village to, raise a child, right? So now if you have a child with special needs, then you need specialists and you need that village to raise a child. And if you have the support of all these people, please do take support, please do take help. And once you have all the support systems in place, children with Down syndrome can do very well in life. So I don't think the parents need to get disheartened. They should just be patient, keep maintaining, as we have all discussed, the interventions on a regular basis, and the future is bright.
Dr. Stuti?
I believe that a lot of parents struggle with communicating with the child, and they also feel that the child will not be able to grasp communication or will not ever understand what they're trying to say or trying to teach the child. What I want people to understand is that children with Down syndrome, the communication begins in the womb for all children. It begins right when the child is inside, when the mother starts talking to the child, when the child is hearing noises, when the child comes out into the world. Communication has many, many ways of getting across to you. If you provide the right sort of intervention, there is no one shoe fits all over here. The fact that communication of a child with Down syndrome will come to you in various forms, whether it's through their facial gestures, whether it's through their body language, whether it's through a sound that they are vocalizing. It's always there. You just need to pick up on it and enhance it. So my takeaway to the parents, my message to the parents would be that please help your child communicate, and please communicate with your child. They are very receptive to it. The more you talk to them, the more improvements you will see.
Rajni?
So for me, as we all know, as we've all discussed it, for holistic development of the child, it's a collaborative effort. But for parents, yes, it's an immense responsibility. So my message is, please don't give up on your child. Be very positive and always look for strengths. Don't look for weaknesses, but look for strengths of your child. And that way you can guide the teachers and you can guide the other people also about the strengths of your child, so that everybody helps in improving the child, and the child is able to achieve certain goals in life, meaningful goals in life. So for my message is clear, that please be positive.
And with that, we conclude today's wonderful session. A whole lot of insights. I hope you all have benefited from it. So let's keep tuned to this space for day 2, where we will be taking up other issues which have come up during this discussion, especially counseling issues and behavioral issues of persons with Down syndrome. So keep growing, keep learning, and let's make this world together more inclusive. Thank you for joining us. And if you have found this episode helpful, do like, share, and subscribe to the Neuroaid and Research Foundation social media platforms and YouTube. Thank you.